cochlear nerve has two components, one for hearing and the other for balance. Today we're only going to test hearing. Saki, is your hearing normal?
Yes.
You have no difficulty with hearing?
No.
Let's imagine that Saki has difficulty with hearing. We have to determine whether the hearing is a problem in both ears or just one ear. We're going to test your hearing, and I'd like you to cover your left ear in the following manner. Now, I'm going to make a noise outside your right ear. I'd like you to tell me when it stops.
Stop. Stop. Stop.
So let's imagine that Saki has difficulty in hearing in his right ear. We can determine the degree of hearing loss by moving behind him in the following manner. Saki, I'd like you to repeat after me what I'm saying. Please cover your good ear or your left ear. Okay. And from approximately 1 meter behind the patient, you whisper. Please repeat after me.
1, 2, 3.
Saki has normal hearing, but let's imagine that he's still unable to hear. The next step is to speak it. Please cover your left ear. 1, 2, 3.
1, 2, 3.
Let's imagine he still can't hear. The next step is to shout it. 1, 2, 3.
1, 2, 3.
And in that way we determine the degree of deafness. To demonstrate the ringing test, you just place a beating tuning fork over the patient's mastoid bone and you ask the patient, please tell me when you stop hearing it.
Stop.
Then you place the beating tuning fork outside the ear canal. Do you still hear it?
Yes.
In this case, air conduction is greater than bone conduction, and that's normal. That's a normal ringing test. Let's imagine that wasn't the case. That Saki heard best here. Tell me when it stops.
It stopped.
And we place it over the extremity here. Now let's imagine you can't hear it. That would mean that bone conduction is greater than air conduction. That would indicate conductive deafness. In order to do the Weber test, you take a tuning fork, you make it vibrate, and you place it in the midline, usually on the top of the forehead, and ask the patient, Saki, which ear do you hear that best in?
Both ears.
That's a normal Weber test.